Thank you all for joining us today. We are super excited to have you. Welcome to Stanford Healthcare's Nurse Residency Program Interview Preparation Webinar. I'm going to go ahead and ask that as you're joining us to please mute yourself, as this is a live webinar. This meeting is also being recorded, and so we will go ahead and have this recording posted for you. By the beginning of next week, we should have that ready. So stay posted. You'll be able to find that on our nurse residency program site at Stanford Healthcare. I'm going to go ahead and also ask you to hold all of your questions till the end. We will have a live Q&A portion with our panelists from the nurse residency program, and then our residents from the panel from the nurse residency program. And then also we will have some individuals answering some chat questions as well, but we'll get to that a little later, okay? So let's go ahead and get going. Our objectives for today, well, we're just mostly hoping that you will be able to understand the program structure for the panel interviews, and then understand the key features for interviewing, and then be able to articulate some strategies to help you feel prepared for the behavioral interviewing itself. I'd like to take this opportunity to introduce our team. So again, my name is Christy Norris. It's my pleasure to introduce Leticia Cortez and Carrie Zoss. We are nursing professional development specialists with Stanford Healthcare, and we support the nurse residency program along with our HR partner and senior talent strategist, Carly Dye. I'm also excited to share that we have 3 of our nurse residents joining our panel session today. They are going to share their experiences in the interview process and in the nurse residency program, and we'll give them a chance to introduce themselves a little later on. So first, a little bit about who we are. So our residency program is 12 months in length. If hired, applicants are hired into a clinical nurse 1 position and then participate in our 12-month nurse residency program. Carrie, Letty, and I do not hire you. You are hired by the hiring manager that you are interviewing for. We often get that question. Residents and candidates can sometimes be confused about that piece. We meet a minimum of 8 hours per month in a classroom setting. These lectures are part of your working hour commitment. And so during that week, you are paid for that time when you attend and participate in these lectures. Some other questions we get asked is, when do we start on the floor? So if you were to be offered a position for Cohort 31, the start date is August the 19th. So your orientation on the floor will start 1 week later on August the 26th. If you have salary and benefit questions, I will ask you to please refer to our application webinar that we hosted earlier this year. My colleagues are going to put a link in the chat for you if you missed it or unable to find it. And so now that you have some clarity regarding the residency program, I am going to share some information that are also very frequently asked questions related to the panel interviews. And so this is the time to pay really close attention. Okay, so this is the list of the hiring units and departments for Cohort 41. So our position control has not been finalized, and it's based on really the unit need and availability. We anticipate offering 40 positions for this cohort. And now I want to share our timeline for Cohort 41. Go ahead and take a picture if you want to, if you find that helpful. So you can see from the timeline here, application, as many of you probably know, posted back in April. We then spent 5 weeks screening all of the applications. And currently we're in the interview offering stage. And so that started just a few days ago and should wrap up by June the 14th. These interviews are being offered on a rolling sequence, meaning that we're releasing small batches of these offerings for interviews. And then as applicants have declined or accepted, then we're releasing the next batch. So it's in a rolling sequence. Panel level interviews start June the 17th, and then they will conclude with unit level interviews by June the 28th. HR will then spend the next 7 or so weeks offering interviews from July to August, and then cohort start date is August the 19th. One important date I want to call your attention to is our July 12th, 2024 date That is when you must have your California RN license. That is a non-negotiable date. You must have it by that date. All right, I'm going to go ahead and move on. So if you needed to take a picture, I hope you did so. I now want to share with you the panel interview dates. So this is the panel interview schedule. Again, take a picture, but let's look at it a little bit closer. I'm going to kind of break this down by panel. So the surgical panel 1 includes 4 different units. That's J5, which is our cardiac surgery and heart transplant, thoracic surgery, which is also heart and lung transplant. Then we have K5, which is hepatobiliary and minimally invasive surgery, and M5, which is hepatology, nephrology, and liver and kidney transplant. The interview dates for this particular panel is going to be June the 19th. Surgical panel 2 consists of K7, which is our trauma and acute care surgery, L7, which is orthopedics, G1, which is GYN oncology, and then H1, which is ENT, plastics, breast oncology, and pain. Also interviewing June the 19th. Our first medicine panel is our medicine units, B2, B3, C3, Sequoia. Those are all on June the 19th. And then medicine panel 2 will be interviewing on June 18th, which is our vascular and cardiac medicine unit, M7, neurology, epilepsy, and stroke, L5, and then advanced lung disease, M6. Our oncology panel, which is featuring our units C2 and F3, are interviewing on June the 19th. Emergency medicine, clinical trials, and float pool are all interviewing on June the 18th. And then inpatient psychiatry is interviewing on June the 20th. So the majority of these panels will be finalized by the end of this week. And so I want to make sure, again, you have an opportunity to take a picture of this. That way you understand when these interviews will be taking place and can be planning accordingly. So in total, 1,341 applications were reviewed, and we will be offering 180 panel level interviews. We are currently sending out invitations for interviews. Interview invitations will be sent via email using the email address that was provided during the application phase. Once the applicant or candidate rather accepts the interview date and time, an auto-generated email will be sent to the candidate within 24 hours with information regarding the interview and the corresponding Zoom link. So what I want to say here is that sometimes these emails can end up in maybe a junk or a spam folder. So please be checking these folders. If you do not receive this auto-generated email, please reach out to newgradrn@stanfordhealthcare.org. So to clarify that if in 24 hours of accepting an interview date and time, you have not received that auto-generated email with the interview confirmation and Zoom link, and you do not see an email in your spam or junk folders, please contact the New Grad RN email that is on your screen. Okay, this invite will not be sent the day before, so please don't sit and wait on that. So following panel interviews, unit level interviews will be scheduled. The dates and times for those will be at the discretion of the hiring manager. And then unit level interviews will be completed with final offers made to human resources by August the 16th. So now let's discuss the nurse residency program interview structure. After your application is screened and scored, and then depending on your score, you may be invited to a panel level interview. So we utilize a two-phased approach to the nurse residency program interviews. The first phase is a virtual panel interview, and that's conducted via Zoom. These interviews last approximately 1 hour in length, and there are a total of 4 and sometimes 5 prospective candidates on an interview, as well as the hiring managers for that specialty. The interview features behavioral style interview questions, and due to the number of candidates being interviewed, there's not an opportunity at that time for candidates to ask questions. At the conclusion of this interview, candidates are provided with next steps regarding the next phase, which is phase 2, and that's the unit department level interviews. So if a manager would like to invite a candidate to a unit or department level interview, the candidate will be called via phone by the hiring manager following the panel interview. Unit level interviews are in person, therefore you should expect to be having an in-person interview. The structure of the interview is at the discretion of the hiring manager, and there are additional leadership members that could be in attendance, like the assistant patient care managers, maybe the unit educator, maybe their clinical nurse specialist. And then in addition to those leadership members, there could be a member of the clinical nursing team on that unit. So during this time, you will also have an opportunity to ask questions. So we recommend that you come prepared with that. Perhaps you might want to know how preceptors and nurse residents are paired, maybe the training that preceptors receive, or what makes a nurse resident successful. So be thinking about what questions you might have. So let's discuss the panel interview process. So you will be provided a Zoom link for the specific time you are scheduled for. My suggestion is you log in about 5 minutes ahead of time. So at this time, you would be placed then in a waiting room. Once you're brought into, or out of the waiting room, I should say, and into the interview, you will be given some instructions and the hiring teams on the panel will introduce themselves. The interview will begin with each candidate introducing themselves, where you went to school, your relevant work or volunteer experience, and then any other pertinent information that you would want to share. This is really your opportunity to connect, make your good first impression. There will be opportunities for you to present this in a concise format. So we're going to ask that you are organized. You will have about 2 minutes or so to share that information. So you want to make sure that you're practicing ahead of time so your best self shines. Interview questions are asked in a rotational sequence so that each candidate will have the opportunity to be the first to hear and respond to a question for the first time. And then after each candidate has been asked all the questions, the interview will conclude and next steps will be provided. Now I want to share about how to prepare for a behavioral style interview. So questions with a behavioral style interview really focus on a candidate's past experiences. You're going to hear questions phrased in a certain manner. For instance, tell me about a time when, or give me an example from your previous experience. We utilize this style of interviewing because by asking a candidate to provide examples of how they've demonstrated certain behaviors or knowledge or skills or abilities, it's in the past that we can then kind of predict how they would respond given a similar situation in the future. So these questions will be asking, what did you do rather than what would you do? So, sorry, skipped ahead. Let me go back. So answers to these behavioral style questions should really provide some concrete evidence for us as to how you, the candidate, would deal with these issues in the past. The information really serves as that best predictor and really determine how a candidate would respond in the future. So you may be prompted with a question and then feel like you've not had that experience. So we don't recommend that you say, I've not had that experience. Instead, we want to encourage you to just pause for a moment and think about your experiences and then use the best scenario or experience based on the question that you were asked. The questions really are general enough that you would be able to likely have encountered that situation. And so remember, there's really no trick questions here. We are just trying to get to know you. This is a conversation. So the panel interview is not going to ask you clinical questions. They're going to ask you questions regarding your experiences, not about tell us about the pathophysiology of the heart, or tell us about a patient that was having a stroke. Nothing like that. It's rather, they're going to sound more like, tell us about a time when you had to respond to a patient who had a concerning clinical condition. The interview style really allows us to assess the critical areas of the job requirements, as well as really those critical areas to our broader culture and our organization. And so what does that mean? That not all of our questions are going to focus on clinical scenarios. So now, where do you start? You might be asking yourself this, how do I begin? Well, we have some strategies for you. So think about all the qualities of a clinical nurse. There are several in front of you. So it could be delegation, someone who's compassionate, someone who demonstrates teamwork or advocacy. There's many. These are just represented few. And then think about the experiences that you've had with your clinicals, your academic experiences, your volunteer experiences, in which you have demonstrated those qualities. So when brainstorming these experiences, be aware of the role you are interviewing for. it's that of a clinical nurse. So if you previously or currently are working in the service or retail industry and utilize an example from those experiences, then the panel may see you in that light and not in the light of a clinical nurse. And that's what you're applying for. So we want to encourage you to really keep that in mind and try to focus your answers from a time when you were functioning in the role of a nurse. So now that you've identified these qualities, you have your experiences, we want you to elaborate on that. So what happened and what part did you play? What actions did you take and how did you respond? And then what was the outcome? So let's run through an example. An example might be, tell us about a time when you have provided compassionate care to a patient during your clinical rotation. So what happened? Set that scene for us. During my med-surg clinical rotation, maybe you were caring for a patient, maybe you were educating a family. What was going on in that moment? And then what part did you play? You were the primary nurse. You are the main character of your story. So how did you move that situation forward? How did you solve that problem? And then think about, how did you respond to that situation? So how did you move the situation forward? How did you solve the problem? Did you walk in and maybe you identified the patient was lonely? Maybe they were withdrawn. Maybe you took time to sit down and speak with them and kind of got them to share why they were feeling the way they were. You assessed that they were feeling a certain way. And so once you gathered all this information, what actions did you take? So then you communicated that maybe to your preceptor, maybe to your clinical instructor. Who did you share that with? And then what recommendations did you provide them? Maybe you said that you were going to sit with them during lunch and, have a meal with them. Maybe you took a collaborative team approach. You engaged the nursing assistant. Maybe you engaged the chaplain. Maybe you discussed with physical therapy to see if you can get the patient to get outside for a little bit because you know that she loves gardening. Maybe you offered some video calling options, or you connected with the family to coordinate a time for them to actually maybe see each other, or you coordinated a visit, or you coordinated that video chat. What did you do? And then what was that outcome? So based on everything you did, was the patient more engaged? Did they participate more in their care? Were their spirits lifted? Was she finishing her meals? It could be a number of different things. So what happened as a result of those actions? And then if you noticed in this answer, I was demonstrating several different qualities of a clinical nurse. I was demonstrating some advocacy. I was demonstrating teamwork, compassionate care, delegation, effective, I talked about communication, teamwork. There's a lot of different qualities there that I was demonstrated in that answer. So think about those, because if you should get a question and you're not sure about the answer, one of your experiences could perhaps lend to that question just based off the quality you're trying to demonstrate. So think about that. And it's not just about labeling those actions, but how you demonstrated them. So where do you start? Now that you have all those qualities of clinical nurse and you have your stories, and remember, it's not just a story, but a well thought out story. What happened and what part did you play? And how did you respond to that situation? What were the actions you took? And then what was that outcome? So now it's time to practice. So review your story so you feel comfortable in sharing these experiences. So choose stories that are not overly complicated. Ensure that you are the key player in these stories. So we always suggest that you write some of these questions down and you put them in a jar so that you can randomly pick them out. Some questions, we'll kind of get into what those could be. But for example, tell me about a time when you advocated on behalf of a patient. Tell me about a time when you had to work on a team. Tell me about a time when you had to demonstrate empathy. Or maybe it's describe a time when you were on a team and they weren't functioning cohesively. Or tell me about a time when you had to provide some compassionate care. So think about those roles. Speak in front of a mirror, record yourself, practice with a friend, speak out loud. It really helps to talk out loud so that you can hear yourself and then make those corrections. And then the more you practice, the more comfortable you're going to feel. And the more comfortable you'll be able to feel, the more you'll be able to really let your true self shine. And I have to say that even, with my most recent interviews for this role, even for example, I was doing these same techniques. So this is how you interview for professional roles. And so it really takes a lot of practice. You got to put a lot into it. Now, where do you start? It's time to perform. You've done all this work, so you want to get ready now for the interview itself. So put yourself into a quiet room. You want to limit those distractions. I don't know about you, but I have a dog, and every time I get on the phone or a Zoom, a blade of grass should dare move in my backyard, and that dog needs to bark, or something else needs to happen, or they find the squeakiest of toys. Maybe you have a cat. It's happened before in interviews where you just see the cat walking across the screen, putting their face in the camera. All these things can happen. And so try to limit those distractions for yourself. You might have a lot of feels at that time, nerves might be kicking in, and it may be a little too distracting for you. Ensure that your device is charged. Make sure you're plugged in. Listen carefully to each question and ask for the question to be repeated if you don't understand it. And if you're nervous, remember this is a conversation. We're just trying to get to know you. Remember to breathe. Oxygen is a good thing. So it's going to help you to think, but it's also going to help to calm the nerves a little bit. Interact with the panel. Show them your personality. So remember, it's both about what you say, but also about how you say it. And then don't let others' answers influence yours. And we'll get into that in a little bit. So let's talk about the interview itself. And so our biggest recommendation is to listen. Listen to the question fully and then ask for clarification if you need it. Do not answer a question until you fully understand what is being asked of you. Don't overcomplicate the question. They're not that tricky. They're actually not tricky at all. But just make sure you understand what is being asked. Again, breathe and try to relax. Don't rush your answer. Be mindful of what is being asked for you and stay on topic. The questions will have multiple components, so listen carefully to each one of those so you're answering the question completely. No trick questions. And then don't answer the question with, I do not have that situation, or I have not experienced that situation. You have all experienced these situations one way or another. So just pause for a moment and think about something that lends to the question. And then use examples from your clinical rotations, your internships, your externships. Use all those because remember, as I said before, if you're using examples from your personal life or a previous life, then the managers may not see you functioning in the role of the clinical nurse. So remember, we really want to encourage you to use those examples from your experiences and just really try to be mindful and focus on that. You are interviewing for the role of a clinical nurse. And then bring that best self, okay? Don't read your answers. They're going to know that you're reading. They're going to be able to tell. Limit those distractions. Try to connect with your hiring managers. So thinking about, if someone were saying something that maybe it's kind of a funny story, it's okay to laugh. Your audio will be on, so don't laugh necessarily out loud, but it's okay to, kind of nod and engage and show that you are acknowledging that that is a funny story. Don't be swayed by other people's responses. So be authentic to your story. It's your story and be proud of it. Don't try and change things up to compete with another example or experience or story because that will make it harder on yourself and you might not be showcasing your best self. We're going to say it again over and over again. Remember to breathe. Remember to take those breaths. It'll help to settle you down a little bit and help keep that brain working as the oxygen is flowing, okay? So let's go through some examples of behavioral style questions. So we've given you a few, actually several already. So we're going to go through these three specifically. So tell us about a time during your clinical rotation when you identified a clinical concern with your patient. What happened? How did you respond? And what was the outcome? So in this question, be thinking and asking yourself, what prompted you to determine there was a clinical concern? What did you identify in this situation? What had you thinking that something didn't seem right to you? Did you tell anyone? Who did you notify? And then how did you choose to communicate that situation? Did you use SBAR? What was your method? And then did you need to educate the patient on what was happening? What was the outcome in that situation? What did you need to share? And how did that apply to this particular question in terms of this clinical concern with the patient? And again, remember that you are the star of the show. So what was that outcome? And then tell us about a time when you realized you needed to communicate effectively to a clinical colleague. Maybe that was a nurse, maybe that was your clinical instructor, maybe that was someone on the provider team regarding a change in your patient's clinical condition. What happened? What actions did you take? And then what was the outcome? So here you're thinking about, again, that communication style. What was it? How did you communicate that information? And how did you prepare for that? Did you practice ahead of time? Was it you needed to speak to your preceptor? So maybe you practiced with your clinical instructor. Maybe you kind of paused for a moment, took a few notes down, and then rehearsed for a second, and then went to your preceptor to share this information. And then did you need to pivot or make any changes based on the response of your audience? It can be very difficult to provide feedback. It can also be difficult to hear feedback. And so perhaps in this situation, they reacted to the feedback and then you had to pivot your next response to that based on what they said. And then this last question, tell us about a time when you received valuable feedback to enhance your clinical practice. How did you respond? What did you learn from this experience? And how did you apply this feedback into your clinical practice? So again, it's, did you respond or react to this feedback? So reactions are usually very emotional versus responses where you tend to pause for a moment and then communicate what you need to communicate. Did you show gratitude for this feedback? Again, feedback can be very hard to provide and very nerve-wracking. And so when someone provides that to you, did you say, thank you, or I appreciate that? And then how did you integrate this feedback into your practice and what have you learned from the situation? So thinking back to the situation, what changes have you made to your practice as a result of the feedback you received? It's not about what would you do in the future, it's about what did you do, okay? So you'll probably also see some themes with the prompts with the questions. It's all tell us the story, set the scene, and then what did you do and what was the outcome, what happened? So think about that as you're preparing your experiences and your stories. Now, lastly, I just want to share a few tips with you. We talked about all these already, so I'm going to go through these again. They're just some reminders about being true to yourself. Okay, we spoke about that earlier. And then connect, nod your head, smile. It's okay to laugh if there's something to laugh about. If it's an emotional one, it's okay to like acknowledge that with, the way that you are positioning your body. Don't allow others' answers to diminish your story. We talked about that. And really, it's about being proud of your story. Your story is going to include, what happened and what part you played, what your actions were, and then what the outcome was. And so be proud of that. It's your story. And you might even be feeling that maybe you didn't have certain experiences. And so maybe you're not as great as maybe you think another candidate is or may be. Don't be discouraged by that. It's all about how you respond to these situations and these experiences and then what you make of them. And so also we want to say, don't allow your answers to be minimized. So again, be proud. Remember, it's about what makes us all different, okay? And about what makes us great. So tell your story, celebrate it, be proud of it, and emphasize that. And if nothing else, remember, this is a conversation. It's a back and forth between you and I. We're just trying to get to know you. Don't make it any bigger than that. And so that concludes how to prepare and practice and perform in an interview. And so now I'm going to hope that you were able to find this information helpful and that it answered many of your questions. And we understand that you might have some additional questions today. So I want to provide you with that opportunity to really ask our residents your questions related to the interview process. In the chat, you'll have the option now to ask your non-panelist related questions. And so here I'm going to ask our residents to introduce themselves one by one, and I'll call you out. And you can have this moment to kind of share just, your name, your background as a student, what school you went to, and then what unit you were on. So Daniel, I will have you talk first. Do you mind introducing yourself, sharing a little bit about your background as a student, and then what unit you're on?
Yes, of course. Good morning, everybody. My name is Daniel Carr. I went to Cal State East Bay, Hayward campus, and currently I work on F3, which is a medical oncology floor. And I'm very happy to be here, and I hope I can provide some insight to everybody.
Thanks, Daniel. Yasmin?
Good morning, everybody. Thank you for having me. My name is Yasmin. I went to school at the University of San Francisco, got my BSN there, and right now I currently work on L7, which is an orthopedic surgical floor. I just wanted to shout you all out for being here, for making it this far. It's not a joke. It's a very big deal. So very proud of you guys. Keep it up, and I hope I can provide some support today.
Thanks, Yasmin. Jeff?
Hey, good morning, everyone. My name is Jeff Diamond. I went to San Francisco State. Go Gators. Let's see. I'm on G1. We were C2. We moved to G1. We are a medical oncology unit. Yeah, I'm really excited to share and answer the questions, and really excited for all of you for being here.
Thanks, Jeff and Daniel and Yasmin. We appreciate you so much for joining us today. So what I'd like to go ahead and do is now open it up to some questions that you will have for our residents regarding the interview process. I'm going to ask that you just put your virtual hand up, and then I will call on you guys. And then in the chat, feel free, if you have some non-panelist questions, to go ahead and plug those in there. All right, so I will open it up. I know sometimes it takes a minute. Hopefully you've been thinking about those questions and what you might be interested to know. I'm going to try and change my view so I can see folks a little bit better. So what questions do you have? There is a ton of you on the call. What do you want to know? Yes, Christina. Christina, go ahead and come off mute. Oh,
Hi
there you are.
there. My greatest apologies. I first want to say thank you so much to everyone for giving their time to be here and to assist us. I wanted to ask a few questions regarding when it came to the interviews about whether you were giving examples that had to do with your clinical rotations, or if the questions also had to do with maybe after you graduated nursing, you may have already gotten a nursing job for a few months or so. Did you use examples from that current time as well? And I also have a few questions regarding non-interview as well, but maybe there's another time for that.
Yes, non-interview. Go ahead and put those in the chat after. But I will have Daniel, Yasmin, Jeff. One of you want to answer her first question?
Yeah,
Yeah,
sure.
I can.
Sure.
Yasmin,
Go
you want to
ahead.
go?
Yeah, go
I'll
ahead,
go.
Yasmin.
Thank you for the question. I would say personally, take every experience that you've had, whether that's clinical rotation, your job, whatever it is, because that counts as experience, that counts as you being with the patient. Use all of that knowledge, because a lot of people don't actually have that much if you were a nurse already. So take that. It's not individualized to just school clinical rotations. Use whatever you have. I was a nursing assistant, and so I used knowledge there. I traveled, did some volunteer work outside the country. I used experiences there. I think that makes you a more well-versed candidate. And yeah, it's always great to have more experiences to draw from.
Daniel, did you have anything to add?
I think I just kind of echo what Yasmin said. I was an LVN for a while before going to the RN program. So I had, several experiences, sort of at the bedside with patients. And I think you just have to kind of focus on sort of the aim of what they're trying to achieve. They're trying to see, you know, more or less how you interact with patients and how you will respond in certain situations. So however you can kind of relay that to them based on your experiences is it doesn't have to be like just, you know, only in like nursing school. It just kind of, you know, how you can best present yourself to them and how you respond to situations.
Thanks, Daniel. Randall, did you have a question for the residents?
Hi, yes. Thank you guys again for being here and giving us this interview prep webinar. This is for the panelists. I just wanted to ask if you guys had any tips or any advice or your experiences of kind of what made you stand out from the rest of the candidates. Because I know that, you know, you're all getting asked the same questions. I kind of want to ask what made you guys stand out?
Thanks, Randall. Hey, Jeff, do you want to take that one?
Yeah, I'm happy to take that one. Thanks for the question, Randall. I think what comes to mind was first thing that comes to mind is I was prepared. I practiced. You know, there were other people in my interview that I could tell hadn't maybe necessarily put in as much practice, and I think that made me stand out. The other thing was, I think, just how I sculpted the answers, the storytelling aspect. You know, I really when they ask these behavioral questions, you know, we're gonna set them up with, this was the scenario and this is how I reacted, like Christy explained. I think it's really important to remember the part of the answer that shines is the part that's about you. So the part that was about me. So like the setup for the story, keep it short, keep it simple. Like you're being interviewed by people who well-seasoned nurses. They have decades of experience. They've seen and heard it all. So you're not going to present with them some ultimately unique situation in the hospital. What's unique is how you responded to it, what you did. So I really tried to analyze, like, you know, I don't need to tell them, me and my preceptor just got off of lunch and we went into the room and they hadn't finished their lunch yet. And so we were deciding what we were going to do, like short and sweet, like the patient passed out and this is how I responded. And I think I used a lot of wordage like, you know, the patient, you know, I noticed that the patient got confused all of a sudden and there was a change in mentation. So I was thinking, that was like a term that I would use, like I was thinking, you know, you know, what are the steps that I'm going to take? So like really showing like what is going on in your mind, what's your thought process, how you're using the nursing process. And I think that really made me stand out. Hope that answers your question.
Yeah, that was great. Thank you for that, Jeff. I
Thanks,
also
Jeff.
have one
Yes,
more.
go ahead, Randall.
Okay.
Yeah.
So aside from the actual interview itself, and I know you guys said to really prepare, that's how you really calm the nerves. I guess that's what I want to ask about next is what are some of the things aside from actually preparing, maybe the morning of, the night before, what do you guys do to kind of calm your nerves and ease the anxiety? Because I know that plays a big factor in how you perform.
Yeah, great question. Daniel, you want to take that one?
Yeah, of course. Thanks for the question. So I think for me, I kind of like what Jeff said, you have to prepare. And for me, the way I did that is I would call my girlfriend and I would just say, hey, I want you to kind of ask me some questions related to like these areas, right? Prioritization, time management. So I actually had her interview me and she would give me honest feedback. She would say, well, you know, when you're answering this question, I feel like you weren't looking like at your camera. So I'm like looking down or I'm looking away. And then also like the in-person portion, you know, making eye contact. And so she would give me like real-time feedback. And I feel like that helped a bunch. And then you just have to remember just, you know, I think with preparation comes some confidence, but, you know, at the end of the day, you just have to give it your best shot. You know, you have the competition is fierce, but, you know, just try your absolute best and just try to put yourself out there, kind of wear your heart on your sleeve, let them see you, you know, show them who you are. And at the end of the day, it's like we all just try our absolute best.
Right. Cool. Thank you for that, Daniel.
If I
Thank
can
you.
add a little bit to that, I think it's given that you prepare a whole lot for these interviews. But the day before, I think it's super important that you step away from all this for a minute, do something that calms your nerves, do something that you love to do, whether that's just watching a show, a movie, talking with your friends about like how far you've come, passing the NCLEX, whatever it is, just to take a step away from it, because I know you guys are all great and I know you guys will work hard towards that interview. And you guys have been prepping, and of course, do your mock interviews, write your questions down so at least you have an idea of like, they ask a question, you kind of know what to say. But eat a good breakfast the day of, get like 8 hours of sleep, drink your water, do all those non-studying things that you've been doing for the last 4 years too.
Right. Thank you for that too.
Yeah, great. Those are great. That's a great addition. I agree. I think preparation is key. And then I also think it's key that you take a pause, go on a walk, get some fresh air, enjoy a treat beforehand. So you're just, your soul feels good going into this. All right, Yasmin, do you have a question for our residents?
Yeah, hi. I wanted to thank everyone for their time and all their feedback. It really is important for us to hear from someone who's already been through it. But I had two questions. So my first question would be, I know that the questions are going to be like kind of generic or just overall so that everyone can answer them. But if we have an experience in nursing school that was more with being part of nursing board and having to deal with different situations with nurses, rather than patients, would that be a good answer for a question, or should we stick to just like clinical experience?
Is that for the residents or are you? Okay. So Jeff, do you want to take this one?
Yeah, I think all the experiences that you have are gonna add to like the strength that you have in the interview, because you may get a question that asks about working in a team dynamic and work, and because you're getting interviewed about how the managers, they want to see how you're going to be with the patients, but they also want to see how you're going to be interacting with their staff. That you're responsible, you're going to be responsible to be a good team member. So anything that you have, and those stories, and whether it's going to be in the panel interview or if you get to the in-person interview, those type of questions are going to come up. And if you have that experience to glean from, all the better.
Okay, thank you. Yeah, that helps. And then I had one more question. It was like, basically, if we had a specialty unit for our preceptorship, and if they're asking, obviously my preceptorship actually it was in obstetrics, and it wasn't in any of the positions and units that I'm currently interested in. Would those clinical changes or conditions that changed apply to the questions if it's not related, or should I still use them?
Oh, you can absolutely use them. That's part of your capstone or, whatever you're experiencing now. Absolutely. Absolutely. It's about answering the question. The location or unit specialty, that part doesn't matter as much.
Okay. Thank you so much. I
You're
appreciate it.
welcome. You're welcome. Erin, did you have a question for the residents? Oh, we can't hear you, Erin. Okay, you work on your audio and then let us know if you have another question, or feel free to put it in the chat too, okay? Crystal, do you have a question?
Hi, good morning. So I just have a couple of questions. The first one was, so, the tell me about yourself portion. I know that, we should definitely touch on our professional, skills and stuff like that, and experience, but I'm wondering, should we add also like something personal, like, or is it, that's not exactly what you're looking for?
Yasmin, do you want to take that question?
Yeah, that's a good question. From what I remember, I think it's always good to say something personal just to have yourself stand out from everybody else, because I'm sure everyone's going to say where they went to school, preceptorship and all that. So if you have like a volunteer experience somewhere else, or maybe a personal story, that's super quick. Again, I think you only have 2 minutes or something to introduce yourself. So if you can tie it to who you are, I think go for it.
Thanks, Yasmin. And I'll add to that, yes, about 2 minutes you have to introduce yourself. So your story needs to be quick. And yes, of course, if you have something personal, maybe it's, how you ended up here or what led you here and you want to share that, for example, I think that's perfectly fine. Just remember, you want to be concise and you have
Get
a
it all
certain amount
in.
of time. Yeah. Yeah. Did you have
Okay.
another question?
Yeah, one more, just a quick one. So I know there's a panel interview and a unit level interview. And I guess I just kind of wanted to know what kind of energy is it like? Is it going to be kind of like a board of people just kind of staring at you? Or is it going to be more like you said it's a conversation for the panel interview, but will it still be that same kind of energy for the unit level interview?
Yeah, let's have Jeff. Do you want to answer that one?
Yeah. I think it depends on the panel. I'll just speak from my experience. I found that I had been practicing on Zoom with classmates and people that we had kind of organized a group to practice, and there was a lot of feedback from my classmates as I was practicing on Zoom. And when I got to the panel interview, the managers, the hiring managers, the hiring staff there, they're taking notes. They're scoring you. They're not necessarily as engaged as like we are right now even. So don't let that, like, don't even think about that. Don't get in your head like they're not looking at the screen right now, or they're not engaged, they're not nodding, or I had this quip and they didn't, it didn't land. Like, they're listening, and they're totally listening. They're giving you your full attention, and just know that confidently. Like, they're taking notes because they want to make, like, if they're hearing something that they really like that you're saying, they want to make sure that they're writing it down. So like it is a very engaged, even though sometimes it feels disconnected. And then when you get to that unit level, then you're in person with them and you really feel the much more in-person connection. So yeah, that was my experience.
Oh, it's good to know. Okay, thank you.
Thanks, Crystal. Heather, do you have a question for the residents?
Hello, can you hear me?
Yes.
Okay, yeah, I do, but I think Aaron got his audio fixed if he wants to, since he was before me in line.
You can go ahead. That's all right.
Oh, okay. So I guess that's I have a follow-up question with all the lovely questions that happened before. Is like with the second interview, how did you tweak your practice? Because I was going to ask initially, how did you practice in front of a mirror? You said girlfriend, that was wonderful. And you said friends. So like, how did you guys tweak your practice for the in-person? Because it does sound a little bit more intimidating.
Good question. Daniel, do you want to take this one?
Yeah, sure. Thanks for the question. I think for me, actually, the panel interview was a bit harder because I tend to connect pretty well when I have somebody right in front of me versus through the camera. And through the panel interview, it felt a little more challenging because there was like more sort of strict time limits, because it was like 2 minutes and sort of move on, and you have 3 other candidates that are interviewing. But in terms of the in-person, I think some of the standard things kind of popped in my head. Make sure you kind of sit up straight, make sure you make eye contact, and a lot of it just comes down to sort of practicing some of those social skills, right? Like trying to connect with the person in front of you. It's almost in some ways akin to standing at the bedside with a patient. Like, you want to give them your full attention. So for me, I just tried to be engaged. I don't think I necessarily did anything specifically in terms of like being in front of a mirror or anything like that. I know with my girlfriend, again, I sat down with her and I had her ask me questions, and she kind of gave me a few tips and tricks like on my body language. But for the most part, it felt more natural. It felt more like just be engaged. Like, again, treat it as if you're treating a patient and they need your attention. So that's kind of how I did it.
Thanks, Daniel.
Thank you. I guess I have a second question is like, I know like these are supposed to be general questions, but were there like seriously nothing that threw you off where you're just like, huh, give me a moment to think? Like none of those questions?
Daniel, do you want to finish?
Yeah,
Anything?
so I got one of those, and it caught me off guard, and it was in person. It was at the unit level, and so I kind of froze for a second. You know what I did is I just said, "Can I have just a moment?" And they're like, "Yeah, sure." Like it's not a huge deal. "Oh no, you failed. You're never coming back. Don't apply again." Like, I just said, I need a moment. I wrote down a couple things. I thought it through, and then I gave them the best answer that I had. So I think that the biggest thing is, you're going to be presented with challenges all throughout this process, and just trying your best to remember, like, look, I'm just like anybody else. We're all, highly capable of working at Stanford, and I think it kind of shows a little bit of vulnerability. So yes, you might get caught off guard, and you just have to try your best. And again, this is kind of where the preparation comes in, making a list of scenarios and practicing those and thinking those through. And those are going to come to you in times when you're kind of stressed and you don't know how to answer. You'll be like, oh, I remember XYZ time with this patient when I advocated and I did this for them. And then you can kind of tweak that, and you can answer other questions and use some of those other skills in different questions, if that makes sense.
Cool. All right. Well, thank you guys so much. I'll mute
Thanks,
myself.
Daniel. Thank you, Heather. Aaron, do you have a question?
Hi, yes. Thank you so much for the opportunity. I guess you guys can hear me now, right?
Yes.
Oh, yes. To piggyback on Heather's question a little while back. So, for example, you're already in the moment that you're answering a question. This goes to our panelists, right? For example, you're already answering the questions and you just completely blanked out. I mean, you prepared, you practiced, but at the time being when you're delivering, you're performing, you just blanked out. How do you guys recover?
Yasmin, do you want to, I don't know if you had this experience, but do you want to speak to that?
Yeah, unfortunately, I have had not that experience. But if it were to happen, what I would do is take a minute, ask them, I'm sorry, can you give me a minute to recollect my thoughts? And then try your best to think of what they asked you. And in that moment, gather your thoughts, recenter yourself, and hopefully things will kind of come back to you. Yeah, that's my best advice there.
Thanks, Yasmin. And I think Daniel kind of mentioned it too, is kind of just like taking that pause for a second and can I have a minute? Daniel, go ahead.
It's okay. I just want to add. So
Yeah.
take notes. Take a binder, take a piece of paper, take a pen. I brought that with me in the unit level interview. When they asked me the question, it was almost like I was being asked a verbal pathophys question or something. I put down the important points. Tell me about a time, okay, that you advocated. What happened? What did you do? I literally wrote the words, and then that way when I was answering my question, I could look over, because it's going to happen. You're going to kind of, for most of us, we kind of veer off path. Try not to. And the best way to do that is just stay organized. Write down that word and say, okay, I advocated, oh, I did this and this, oh, and this happened, and this was the outcome. So like, yeah, just use some notes. I think that will help, writing a couple notes.
Appreciate that. Thank you so much for the feedback.
Thank you. Jeff, did you have any of this experience at all that you could lend to any of it?
I didn't have that specific experience where I blank in the middle, but similar to Daniel, where like just needed a moment, like I kind of blanked on an answer for a moment, and I really like narrowed it down to like 5 or 6. I think it was 6 answers that I had, and like really how like Chrissy presented in the seminar in this presentation, like that circle with all the different qualities of a Stanford nurse, like take your answers and see where does that plug in, because the questions are all going to have to do with something in that circle. And so if you say, like, if you have 5, 6 answers, like I had 5 or 6 good solid stories that each related to multiple parts. So I say, like, I'm not sure, and then all of a sudden the wheels get turning. I say, you know what, like that story actually does work for this, because I could see I can make this story work for this. And maybe I thought I was going to use that story for something totally different. So, in those moments where you're just not sure, like, trust, if you put the work in, trust that you're gonna reap the fruit from it.
Thanks, Jeff. Thank you, Aaron. Ferlin, do you have a question?
Hi, thank you for setting this whole thing up. So my question actually was also the same thing as Aaron's, but you guys answered that question already. And then I do have another question, but it's more for the actual residency program. What's like the turnover rate?
Our turnover rate is actually very low. Our retention rate, I will share that, is at 96% actually. So well above the national benchmark for other nurse residency programs. So it's very, very high. I can let the residents speak to why they think that is. Let's see, Daniel, do you want to, or Jeff, Yasmin, do any of you guys want to speak to why do you think our retention rate is as high as it is? I see Jeff just came off.
Yeah, I could speak right off the gate, like just this seminar in itself, that like really before you're even a resident, I felt like before I was even a resident, I felt supported. I felt like, okay, the invitation was presented. It was my job to like answer that. It was my, so I felt like there was nothing hidden. There was no like nothing vague about it. Like the expectations were clear, and then entering the program, the expectations were clear, and we're really, I think we all landed in our unit really supported by the program, supported by the hospital. Yeah, I'll just share like a few nurses who have gone through residencies at other hospitals, and then now they're working at Stanford. One of my first shifts, they're just like, it doesn't get greener. Like you think the grass is greener somewhere else. Like you made it to the green. So yeah, really grateful to be here. Really grateful to be a part of this cohort.
Thank you.
Thanks, Jeff. And I'll just share my own story is I am actually a new grad of Stanford Healthcare. So I started here 20 years ago. Don't tell anyone. It was a long time ago, and I've never left. It's a great place to work, and there's a lot of support and a lot of opportunities. And so I feel very fortunate also to have had the opportunities I've had. So let's see, Misty, I see your hand up. Do you want to ask our residents a question?
Hi, thank you for your time. I had two questions, if that's okay. Specifically, Daniel, I heard you mention that you were at LVN first. During your panel interviews, was it helpful to mention that you transitioned from LVN to RN? Did that come up? How did you work that towards your benefit during your interview panel?
Yes, of course. Hi, Misty. Thank you for your question. Yes, I mean, I've been in LVN since 2019. And I just want to ask, are you an LVN as well, or?
I'm an RN
Okay.
now, new grad
Yeah,
too.
awesome. Good job.
Thank you.
Yes,
you.
yeah, 100%. I think it helped a ton. I worked mostly like in skilled nursing facilities, subacute, also some home health as well. Having a 35 patient assignment as an LVN is heavy. It's very heavy. Now I have 3. So the time management and the different scenarios and almost 5 years of being an LVN for sure helped. And so for me during the interviews, yeah, I put that out there. I mean, that's directly relatable experience. You're working at the bedside with patients, you're advocating for patients, you're time managing, you're doing all the RN skills, but just at sort of a different level. So yeah, definitely I infused that. I made sure in the unit level interview that I talked about it, the panel level interview. I wanted to let it be known that, I've been on this nursing journey longer than just 2.5 years for my RN program. It's been several years. And that's not to take away from anybody else. It's just my journey and what I've done. And yeah, I totally included that.
Appreciate that input. I wasn't sure if you're supposed to mention that or you're not, because in nursing school, they tell you not to, just focus on the RN. So when you mentioned your LVN, I wanted to ask. So thank you. And then my other question was, did you bring a portfolio with you? Because they kind of hype that up. Do you bring that with you? Is it beneficial, or do you not bring it with you?
Would you like, is it okay I answer that one, Christy, or do you want one of the other?
No, go ahead.
For me, yeah, so I had like a nice sort of, I guess you would call it a portfolio, right? Like a nice, sort of binder thing.
Yeah.
Yes, and you know why? You know why it ended up being so important? Because for some reason, and I still don't know why, but my resume and my cover letter printed so weird in the unit level interview. So my manager, my current manager, showed me. She's like, "This is your resume," and I was like, "Don't worry, I brought like 10 extra copies. So here's one for each of you guys." And they were like, "Oh, great, that's so great." So
Good to
yeah,
know.
it helped me, and then it also has like the paper in it, so I could take notes. So yes, yeah, I would bring one. I would bring extra copies of your resume. I would bring copies of your cover letter. I would bring, I don't know, mainly those, but just yeah, that. So yes, I brought one. It helped me. And again, for taking notes, I'm very for that. I don't think there's anything wrong with jotting down a couple things when they ask you a question. You want to stay on track. So yeah.
Thank you so much for your time. Appreciate it.
Thanks, Daniel. Thanks, Misty. Gabrielle?
Hi, thanks again for hosting this event. It's been very helpful thus far. My question, if it's okay to ask, is I want to hear one of the real examples that you guys shared during your interview as somebody who got picked, just so I can hear like a real life example. Thank you.
Example of a question or
Or of an answer of like
of
what
an answer. Okay. Yasmin, do you want to share?
Sure. I think one question that I got asked was there a time when your patient was kind of escalating in care, and what did you do to de-escalate that situation? And at this time, I mentioned I was a nursing assistant working at Lucille Packard. And so you want to use the STAR method, right? Pretty much what Chrissy has been talking about. State the situation. What was your task at hand? What action did you take? And what was the result? That's kind of your path to answering a lot of these behavioral questions. And so I said, I was taking a patient on a walk, and then all of a sudden she was getting hard of breathing. And so it was just me at that time taking her, and she was kind of almost collapsing. And so I just had to yell for help. Got multiple people involved, put her slowly down onto the ground. We didn't have a wheelchair at that time. And then we took her vitals and stuff where she was and asked her questions. Oh, are you alert and oriented? All that. And then we were able to have enough hands to get her up on a wheelchair and take her back to bed safely. So it's just about like, you want to talk about different characteristics that you use, like advocating or calling for help or teamwork. Use those words, specifically, so they know you are like a team player and you're not trying to do this on your own. It is very much okay to ask for help. Always, always remember that. So that was one scenario that I had. And so, like Christy mentioned, you're going to see a lot of these questions. If you just look them up online, when I was prepping, I would look up, nursing interview questions. And there's a lot of the behavioral ones are like, tell me a time when you empathize, tell me a time when you de-escalated. You'll see a lot of these. And so I would put them on my Google Doc and make an answer, type out an answer. Obviously, like, you're not going to remember every little detail that you type out for that interview to answer. So just having an answer written out, so then when that question is asked, it kind of rings a bell, and then you can go from there. Truly, truly does help. So preparing yourself is great.
Perfect. Thank you.
Thanks, Yasmin. All right, Alicia, do you have a question?
Yes. So, regarding like the questions, if you give a story for a previous question and you find that it connects to another question, can you circle back to that, or would you prefer more examples so you can get a broader perspective of who we are?
So before I give my opinion, Jeff, do you have any thoughts on that?
Yeah, I would say don't circle back. Come up, have something else. Yeah, I would say the more diversity of experiences that you can share, the stronger and the more you'll stand out in the interview. Since that's one of the goals of the interview. And and like, I think it was like 4 questions. It was maybe 5. So if you have 6 answers, you should be able to have a fresh one for everything. It's nice that it can relate and circle back, but I think it's better if you have something original for each question.
Thanks, Jeff. I would agree. I would say that I would agree with that. I think that it's important. There's so many, and I think like we were, as I was mentioning earlier, there's so many different qualities, and that many of your experiences really can lend to multiple buckets with the qualities. And so if you think about your experience and how you adjust that potential answer to maybe lean towards, if the question were more about advocacy versus empathy versus compassion, you can probably lean multiple answers different directions without having to reuse. Thanks for your question.
That helped a lot.
Okay, good, good. Avery, did you have a question?
I did, thank you. I am an out-of-state applicant, and I wondered if any of the panelists have any, sounds like everyone's from kind of the San Francisco Bay Area, if anyone in their cohorts have had out-of-state applicants or other nurses in the residents in the program, and how's that process been for them, both interviewing either from distance or if they had to like fly in for the unit level interviews, as well as just the transition from being an out-of-state applicant to working at Stanford.
Yasmin, Jeff, Daniel, any thoughts on this?
We have folks from all over in our cohort, East Coast, Canada, and it's from what they shared was, I think that the Stanford was pretty accommodating, and the Zoom interview was pretty easy to do, I think, for them. And I think some of them did not have to be in person for the unit level. The managers were accommodating to be on Zoom. Because they got invited for that interview, so they were willing to make the accommodation, knowing
so these are things you're going to be able to do that don't have
flight. But maybe Christy, you can clarify.
Thanks, Jeff. Yeah, so I would say that for those that are out of state, the ideal situation for the unit level is that hiring managers want you to be in person, because that's just a different experience. They want to get to know you and have you physically in front of them. But they do recognize that for some candidates, if you're in, East Coast or Texas or wherever you're at, that might not be possible. And so that is up to the discretion of the hiring manager, whether or not they will move forward with the unit level.
Thank you.
Yep, you're welcome. You're welcome. Okay. Is it Kalichi? I probably murdered that name. I'm sorry.
You're close enough. That's
Sorry.
okay. Hello, everyone. I have two questions, actually. So we established already that the panel interview is going to be more of behavioral style questions. I'm now asking for the unit level interviews. I know there will be some behavioral style questions as well, but is it also going to have some clinical questions?
Good question. Jeff, you wanted to, or Daniel, how about, I think Jeff, you answered the last one. Daniel, want to take that one?
Yeah, so for the panel interview, it was for me anyways, I can't speak for everybody, but for me, and I was in the oncology division interviews. For me, it was just behavioral style questions. I can't remember if it was like 4 or 5 now, but I know in the unit level, I was expecting just only behavioral style, which it was mostly. And then they did give me a case study at the end, and I was like, oh, this is interesting. But from what they had told me is my manager said that it wasn't like a hard fail kind of thing. I don't remember her exact wordage, but she basically was like, we just kind of want to see your thought process. But it was pretty in depth. It was a legit case study. Like, you have a patient with this who's presenting with these vitals, who has these labs. What do you expect to do? What do you think the provider will order? Or like, what would you recommend to the provider to order? And like, what are your nursing interventions and next steps? And so I was like, oh, so that took a second. So I had to like write some notes and like re-ask them, make sure I'm hitting all the points. But the question wasn't anything that's like so profound that like we couldn't answer. It was, yeah, like, I don't know how much I can share, but like it was going through nursing school, you would pick up on these things. Like, it wasn't like the difference between a little heart rate change. It would have been something large, and you'd have been like, oh, either this person's tachycardic or this person's having a fever. Like, it was pretty apparent for the most part. So they just kind of wanted to see your thought process. But yeah, as from what I know, again, I don't think it was like a for sure, if you mess up on it, it's like a huge deal. But yeah, I didn't have too much clarity on that. Sorry.
But they're only.
And then Jeff or Yasmin, did either of you have that kind of experience?
Yeah, I actually fortunately did not have clinical questions, but I will say during my unit interview, it was more personalized questions. You know, where do you see yourself in the next 5 years? What are your strengths and weaknesses? Just, I think, because the unit level interview was more behavioral style. You're just kind of, you have 2 minutes to answer. You just want to get your point across what you did, right? And then the unit interview is more, sorry, the panel interview, what I was talking about. The unit interview is more personal. Like, it's just you, the unit manager, and the unit manager brings in like the APCM and maybe a couple other RNs. And I think that's your time to just really show your personality. I think the unit interview is more of a conversation, if anything, than the other one. The other one is a little bit more rigid, I would say. So if you do get to make it to the unit interview, just be yourself, show your personality, because that's what makes you different than everybody else. You know, don't be like a robot. Smile, laugh, like ask them how they're doing, thank them for the questions. That goes for both the interviews. And yeah, just be you. I think when you're with the unit interview, the panel interview, it's hard because you have everybody else and you're seeing how they respond to things and you want to be like them, and there's a lot in your head that goes on. And so when you're in the one-on-one or the unit interview, it's a little bit more refreshing, because you got to remember you are here for a reason and take that confidence with you. And I think if you do that, that is shown in the way you talk and how you present yourself, your mannerisms. And so, yeah, the unit interview is definitely more personal, and take that to your advantage.
Okay, thank you so much.
Did you have another question?
Yes, I did. So for the panel interview, I keep hearing about the 2 minutes time. And I just want to clarify. Now, we talked about being stumped on some questions or asking about time. Okay, give me some minutes to think. How does the 2 minute timeline, like how does it apply? How rigid is it? Is there like a timer going TikTok, like it's 2 minutes? Like how does
Yes,
this
we
2
have a
minute
big
thing work?
timer. It's like flashing. And so like instantly it's like, just kidding. No, it's not rigid. None of that is happening. We know that there's nerves. We are definitely flexible. We're not going to give you a minute to think about your answer, but we'll give you a moment to think about your answer. So if you should be presented with a question and you didn't know that answer and you said, you know, one way to stall is to say, could you repeat that one more time for me? That's the one way, right? And then if you still need a second, you can say, let me think. Give yourself like 5 seconds, 10 seconds, because unfortunately, like everybody's, you know, we only have 1 hour to do this entire interview, and there are 4 or 5 of you on that panel. And so we want to make sure that we're giving everybody equal opportunity and time. And so it's not a rigid timer, but we try to keep those questions to 2 minutes because we know that you're probably going to go over. And so that allows you to kind of still have that buffer a little bit.
All right. Thank you so much.
You're welcome. You're welcome. Nico, did you have a question for the residents?
Hello, thank you everyone for giving me the chance and also doing this panel today. I wanted to ask the panel, what made you all fall in love with nursing or choose nursing?
Sure. Let's see. Daniel, do you want to start?
Yeah, sure. Thanks for the question, Miko. I think for me personally, it's a special position to be in, right? You're helping people in some of the worst times, not always, but a lot of times, right? Especially in oncology, we work with a lot of very sick people. For me, it's sort of multifaceted, but one, I think just being in that position where you're trusted and to be able to provide like a healing hand to somebody is extremely powerful. You know, I've been in the military before. I've worked in retail. I've worked in the food industry. I held a sign for a auto dealership on the corner of the street. I've done several different things, and I've always kind of walked away with like, well, what about those jobs did I enjoy the most? It was the human to human connection. It was that interaction with people. Even if you're just handing someone some KFC and saying, hey, have a good day, and they have a smile on their face because they have a good lunch, like that's powerful. And then nursing is that, but times like 100. So for me, there's a huge rewarding factor to it. So I guess in some ways it's a little bit selfish, right? But because it makes me feel good to make other people feel good. Yeah, I think it's that human connection for me that I value and treasure so much. And I still value that all the time. When I'm having a heavy day on my unit right now, and I'm doing a blood transfusion with somebody, that's very, very special. There's not many people that can do that. And you're doing something for this person that is just very profound. So that's why for me.
Thanks,
Thank you.
Daniel. Yasmin, do you want to answer that for him too?
Yeah. For me, I just, like Daniel said, I love helping people. I think it started at a young age. I'm also the oldest of 4 siblings. My youngest sister had a cleft lip when she was born. I'm like 9 years apart from my little sister. So it was a lot of like growing up factors too, environmental factors that just made me this caregiver at home, really. And if you guys are older siblings, you know what I'm talking about. It's like second parent at home. So I know a lot of older siblings, they either navigate away from helping people because they're over it, or some people just have a knack for it. And that's what I do. I love helping people. That makes me happy. And I think a lot of not everyone can be nurses. I think you have to have a lot of empathy. You have to have a lot of patience. And I think if you, amongst other things, but if you have those 2 qualities, and you just love seeing people get better, you just want to be there for them, I think this job is for you. And there are days when it's really, really hard and exhausting because it really requires a lot out of you. And you're one person that needs to be at 4 different places at once. But at the end of the day, no matter how challenging it is super rewarding. And it also helps when you have such a great support system, which I can say for myself I do, and I really hope you all do as well. You're in good hands. So just have that empathy and have that drive to really care for others. And if you do, I think you're at the right spot.
Thanks, Yasmin. And then Jeff, I'll give you the final word there with that question.
Great. Yeah, thanks. I kind of want to tie it into a second because in the introductions, I do believe we were asked, like for me, it was more specific. Why am I choosing oncology? So it's a good question to be thinking about when you have your introduction and you're getting ready for your interview. And so I guess I'll specifically answer like why oncology nursing specifically, because oncology nursing is it's a pretty specific population. You don't always get to see your patients get better. They often only get worse. And so I found in my life, I found nursing later in life. I mean, I'm not that old, but still, I had a career before this. And yeah, just finding that I had the gift and the tools to show up for people in the scariest, most vulnerable part of their lives, for them, for their family. And oncology, you get the opportunity to see patients over a course of time, over the course of their treatment. So I really wanted to be able to build relationships with those people, and whether they were on the road to healing or they were just on the road to comfort. So yeah, that's part of my journey to oncology nursing specifically. Yeah.
Thank you, Jeff. And thanks, Mika, for the question. Cece, did you have a question?
Hi, yes. I have one question, and I want to thank everyone for your time for being here. I was just curious, for the panelists, for the in-person interview, were you expected to wear scrubs, or what was the dress code, and what did you guys wear?
Daniel?
I wear a full suit, so I think it's important to dress as professional as you can. It's hyper competitive, as I'm sure you're aware. So look your best. Scrubs are great, but maybe not for this specific scenario. I don't know if maybe I'm wrong there, but yeah, I wear a full suit.
Yes, professional dress attire, no scrubs.
Okay, gotcha. Thank you.
You're welcome. Lakin, did I say your name?
Hi. Yes, hi. I had a question regarding the learning environment, and I wanted to know how the preceptorship has been, and specifically how the preceptors have supported you guys during the transition from student nurse to new grad. And I know in school we get a lot of like nurses eat their young and like new nurse bullying and stuff like that. So I wanted to know like how the culture has been and what has kept you at depth for this in relation to the culture part.
Thank you. Yasmin, do you want to take that one?
Yeah, thank you for that question. I think, okay, so the preceptorship, from my own experience, I absolutely loved it. I had two preceptors that I clicked with. They're like, I really see them as my older sisters. We go out to have drinks, whatever. It's been great. And I hear my cohort, people in my cohort say they also have really great relationships with their preceptors. And the part of picking like a preceptor, they want to do that. They want to teach you. So it's not, I haven't had experiences where preceptors like don't like what they do, you know, and they're mean. I mean, I'm sure there are scenarios where that happen. And if that does happen, you know, you advocate for yourself and just have a conversation with them. And if that isn't working, have a conversation with management. But for me, my 3-month orientation, what my preceptors were so helpful, so supportive. I think I was kind of my biggest barrier to really like thriving. As you all know, we're all here. We're all really critical with ourselves. We have high expectations for ourselves. And personally speaking, I think I just wanted to be really good. You know, I had expectations for myself that, to be honest, were maybe unrealistic. And that caught me when we have these check-ins with our preceptor and our management. And during one of my check-ins, I'm going to be really real with you, I didn't know I was feeling a certain way. And when they were asking me how I was doing, I started crying. And I wasn't going into, I don't want to, like, who wants to show their management that they're crying? Or, you know, no one wants to do that. And so it's a really tough time because you're thrown into this nursing world. There's so much stimulation. You want to get everything right. But I've been working on it with myself. I've been talking to friends in my cohort. I have been talking with my preceptors more. My preceptor made me like this little card because she knows how hard I am on myself. And FYI, it's okay to be hard on yourself. That means that you care, like you want to do a good job, you know? But there's a limit, right? You want to be hard on yourself, but you want to do a good job, but don't push yourself, because if you push yourself, you're going to be exhausted and you can't care for your patients, right? There's a limit to everything. And so my preceptor made me a card that said, you are strong. It is okay to ask for help. All these like affirmations. And she told me to put it in my car, in my mirror. And so every time like I go to work and I look at myself in the mirror, I see that, and I just take a minute to like, wow, I have the support. I'm cared for. And so that was huge. And so talking with people is the biggest thing you can do, because you are not alone. Okay. There are so many people that are feeling the same way. And that is why this seminar, this whole new grad program is amazing, because once a month we have these 8-hour classes where we go, and all 80 of us, or however big your cohort is, we just talk about what we're going through. And it's a safe space that allows you to open up. And yeah, that was my first 3 months. I'm at a much better spot right now. I'm a lot easier on myself. I feel a lot lighter. It's so great. I wish all of you that same support that I had. Just don't be afraid to reach out and ask for help, because that's the biggest thing you can do for yourself, honestly.
Thank you, Yasmin. I appreciate that transparency and honesty. It's not always an easy road. So thank you. Let's see. So we have about 4 minutes left. I see 2 hands up. So let's try and get to these last 2 questions, okay? Tessia, I'll let you ask your question to the residents.
Okay, thank you. Actually, the last question was mine. I wanted to know what the learning environment was like, but I do have another question. So someone mentioned that, or they asked you all why you wanted to be a nurse. And I wanted to know if you all got that experience in your interview, if someone asked you that question specifically, and which interview, like specifically, was it the panel interview? Because I know those don't have a lot of time, or was it the individual interview?
Okay. So Daniel, did you get that experience or that question? Or I think you answered it first time. Sorry.
I got it in both. I got it
Yeah.
in panel and unit.
Okay,
Oh,
thank
okay.
you. Yasmin, did you get it in both or one or the other?
I actually believe I got it in my unit interview. I think the panel interview was more so tell me about yourself. And so I think I added a little bit as to why I love nursing, what made me choose nursing. I think I put a little personal anecdote in there to separate myself from everybody. But I don't remember asking why nursing in the panel.
Okay, thank you. Jeff?
Yeah, on the panel interview, they framed it as part of the intro. Like they said, give us the intro. In your intro, say your name, where you went to school, your degree, and why you chose oncology nursing. And then in the unit interview, it was a more general, like tell us about yourself, why are you getting into nursing?
Okay, thank
Right.
you.
Thank you. And then is it Kayla? Kala?
Yes, Kayla.
Kayla.
I just want to thank you, Christy, Carrie, Yasmin, Jeff, Daniel. Thank you so much for taking the time to talk to us today. I just wanted to know from the panelists, you've been steeped in the residency program now, you've been supported, you've been shaped. Where are you going next with nursing, and how specifically did the residency program show you could go there or prepare you?
Thank you. Jeff, I'll let you take this last question, and then we just have like 2 minutes, so maybe just you can quickly answer.
Good question, Kayla. I'll be frank. I'm 12 weeks into the nurse residency program. So where it's taking me is next week I start my first shift off of my orientation. So I will not be under preceptorship anymore. So it is taking me to independent practice. I think I think it's really been summed up well about like how much support there is, especially through preceptorship. Like the last week or two, people on the unit are asking me, oh, like, are you ready to be on your own? And everyone's sick of hearing me say, you're never alone on C2. Like, it's just my go-to, because like really like everyone on the unit's supportive. I think I'm not the only new grad. I have someone else from our cohort is also on the unit, and then there's someone who's 6 months ahead of me, and then there's someone who just finished the new grad program. So new grads are integrated into the unit, and so it's part of the culture of the unit is having new grads, supporting new grads. I can only really speak for my unit, and I know that the culture is just really great, really supportive. I have experience in other units from being in school at Stanford, and I can speak that it was the same as a nursing student on those units, the support. I think, just the culture of Stanford is a good culture. That bullying, all that stuff that you hear about, I haven't experienced it. I don't know others who have experienced it at Stanford. So it's, I feel really grateful for that. And, I do see myself being set up to pursue or go in the directions that advanced degrees, things like that, which honestly, I think it was the first new grad session we were together. We were asked, like, where do you see yourself going? Are you interested in advanced degrees? And we met with other nurses in Stanford, the nurses I like the nurses who don't wear scrubs, the ones who have taken on leadership roles, who have taken on these other positions. So get to kind of see, what could life look like in the next 5 or 10 years as a nurse. So it's all integrated.
Thanks, Jeff. And thanks, Kayla, for the question. I want to thank everybody today for coming and participating. I want to thank our panelists for sure, Jeff and Yasmin and Daniel. Thank you so much for your time today. And thank you to everybody here for attending. We appreciate your time. We hope you found it valuable and helpful. And one last reminder, this webinar will be available by June the 10th on our career site. So if you go to the Stanford Healthcare Nurse Residency Program site, you will see the link so that you can rewatch to your heart's content. In the meantime, we wish you the best of luck and take care. All right, everybody, have a great day.
Thank you.
Thank you.